There you go. All right. So Tim, do we have anybody who has to make a public comment?
There were no requests for public comments.
Okay. Very good then. Seeing nobody here who's looking to make a public comment, I guess we will move on. Minutes have been distributed for our meeting of January 24th. Any discussion on the minutes? Okay, I'll take a motion to approve the minutes. Motion to approve. All in favor? Okay. Vote. Minutes are approved. Next item, synthetic turf fields.
Okay, so again, to continue our discussion on the Felson O'Neill field turfing results, we contacted them and they were able to get back to us about those two metals that we were concerned about. So they will be able to retest for arsenic, no charge due to their equipment issue. And then they will also could retest for zinc as well. Didn't say they would retest for that free of charge, but they also took your under advisement, the 6 samples for each, so 3 throughout the whole field, so it'd be more samples that they'll test and different aspects of the field. So the question we have is whether or not we want to do this testing first available time frame in the spring, once I get all the snow melts and we get the field access, we could do that, and whether or not you want to do a full round of a testing or just the metals in particular that we had concerns about.
Okay. Question on that?
When is our next regular testing?
So usually we every, is it every other?
Every
year?
other year.
Typically, but, and so we'd have to get the funding available to be able to pull the PO together.
Are they gonna charge extra for those extra samples?
They won't charge for the arsenic sample. But they didn't say they wouldn't charge for the zinc sample, so,
Okay,
yeah.
and then are they gonna take they did 3 samples on the field?
Yeah.
They're gonna take 6 samples.
Yes,
So
they
they're
will
gonna
be able
charge
to.
extra for those, right?
No, that's just a grab sample that they do.
Okay.
They wouldn't charge extra for that.
Okay,
They combine that into one
Correct.
per field, and
Yeah.
it. For the zinc cost, just out of curiosity, how much if they do charge?
Oh,
for
I
that,
didn't get
expect
that
it to be
estimate. I didn't get the estimate on that.
The full cost of all of the work each year is around 10 to 12,000,
Yeah, so,
so it'd be much less than that.
Yeah.
And then the zinc was only found to be elevated at Memorial, right? The other two.
yes, it was a hit, I think they're correct.
I think the other ones were high, but not over the Massachusetts limit.
Yeah. So,
So that would be an option to just do the one field that was high. So we test.
Well, on the other hand, we may have, just like you may have missed something in Memorial, we may have missed something in the other field too. I mean, if they're high, it might be time to test them both.
We do have, as the board knows, the scientific expertise warrant article.
Right.
There's money in the budget for environmental testing, although we've now
Right.
used it. It certainly could be an appropriate use if we wanted to do a more comprehensive second test to tap into that fund.
Right, I mean, that's my thought. I mean, the whole reason we're testing is because we were concerned that the fields might degrade and we may have found something here. So, I would say it doesn't wait 2 years. It's the spring, but it's targeted. The arsenic's for free. They got to come out and take the samples anyway. So they shouldn't be charging us for that. It's to really just to run the, run whatever test they have to do to measure the zinc.
mhm,
probably $1,000 or $2,000.
yeah,
The most, I would guess,
okay. So we can make that,
So let's see. if
That's
we
for
can do
those
that.
two.
Yeah, I mean, if you find that it's, that the cost is way out of range, let us know.
okay,
And we'll do it in the spring.
yes,
Yeah.
okay.
Yeah.
Sounds good. Thank you.
Okay. All right. Next is the Zinn chill flavor pouches, vape products, and all sorts of information
Yes.
from Charles Bar.
Yes, so she was extremely helpful for our team and reviewed that with her. So, yeah, so basically. We had a conference call with her and substance abuse team as well, or on the call. And we are able to ask her some specific questions on how we would move forward with the Zinn pouches. So the guidance that they provided is that, we will be able to enforce the Zin Chill flavor, because they have definitely found that to have a characterizing flavor, which is against, the regulation. So we can definitely, prohibit that product. The other piece was that they might, due to this new FDA article that came out, we could consider limiting the nicotine amounts to 3 or 6. So some of these are up to 30. We were shocked when she told us this during the call, that some of other brands, not Zyn, but other brands are actually up to 30 milligrams of nicotine per pouch, which we're like. So the FDA has already said here, 3 and 6. They've authorized that. So you could limit it to that amount of nicotine for these pouches. The other thought they had, was that, I know we had to ask of them about the advertising, whether we could restrict the cases and things that they were in, and Cheryl unfortunately said that, that was protected by the First Amendment. They really can't go there. And the other item was the QR code, the coupons, that some of them had coupon codes on the base of the containers that one other town was able to enforce, but Cy had since gotten some additional information on those.
Yeah, I did some additional research on like the QR codes, and I think it's just like a rewards program where you could get points over time and use that to like get merch instead of, we had the initial thought was that it could be used to buy more pouches, which is like a coupon discounted kind of thing. And upon like doing more research, I found out it was just a rewards program for merch itself, not for, you could use it to redeem like more nicotine pouches. So so that would be like, and we wouldn't have to like do any additional work related to the actual tins and the QR codes on the back of the tins.
So I guess the only thing really for us to decide here today is the nicotine content issue.
Yeah, I mean, you could definitely look at restricting that, and then the chill as well. We could definitely have that pulled off the shelf, because it is a flavor product. We know 3 out of the 6 retailers in town sell that brand and that flavor, that chill. So that could be one that we could say, you're not allowed to sell, it's prohibited due to the regulation. So.
Okay.
Lydia, I know that Carol's online, and Karen's not. Do you have anything you wanted to add from a substance use prevention perspective?
I think it was well covered by Tara and Cy, but I think Cy brought it up at a meeting a while ago, the flavor chill, it's like a minty menthol type of flavor. Menthol flavorings have been banned in cigarettes across the state. So something similar would make sense, I think, for this product.
You answered my question. What does it taste like?
Mhm.
I do also think that the evidence is not strong that these are a cessation tool. There are cessation tools for smoking and for nicotine, but they're specifically created cessation tools. I don't find the argument that these are a step down product as convincing, but that's to the board's discretion.
I think the rewards program is something that makes me like skeptical of that too. The rewards program Cy mentioned, like the more you buy, the more points you accrue that you can use for like a hat that says Zyn or sweatshirt or water bottle or all these different rewards on their website. Which I feel like that is enticing the young people, yeah.
Yeah, even if it's not, directly funding the purchase, it's an inducement to make a purchase, which is what a discount actually is.
And how easy would it be for us to enforce that?
So there was one other town, I think Cheryl Sabara mentioned that, I can get more information about it, but they had some pushback. I remember her saying it was tricky for that health agent to.
If we pass a regulation, it's basically not forcible. You make a joke out of it.
I think they got pulled into, it was the hearings and things like that.
Yeah, I think the rewards program now is through the actual website on like the national website on through Zan itself. So I think it'd be hard to regulate that in any type of way. We could see if it's being used in town, like do a compliance check sort of thing and see if like the stores have a capacity to like for it to be scanned or something by the store itself and seeing.
Just do a survey and see.
Yeah.
Back to that.
We
I think we should just stick to the quantity of nicotine right now.
Or maybe I don't understand this. Somebody purchases this, they walk out of the store and, and then they use a QR code. How is the store gonna have anything to do with this?
So I think what the other town did was prevent them from, like, they either put a label on or made them not have that available on the bottom of the package. What, do they cover it, or they?
Yeah, I think the original idea was that you could, if there is like merch in the store itself, then the store can scan the QR code, see how many points you have and give the merch
Yeah.
directly. So it'll be on the retail sense instead of being done online through the Zen website.
Okay.
The other 2 points, so about like, I think I had a question about like if the chill version of the Zen product, if it had like a flavor, it has this odorless compound called WS3, and it doesn't have like a flavor, but has a cooling sensation to it. So it's kind of like when you use a menthol or something to like for a cough drop, it has that cooling sensation in your mouth, but it has like no mint flavor or anything. But it's still,
taste.
it has yeah, depending on your definition of taste, but it does have a characterizing flavor to it. And that's how other town or boards of health have regulated it. And then there's also these other types of vape products that have a clear flavor to them. And other towns have found that they might have characterizing flavors as well, but they're hard to, you can't really do a smell check on them because they don't really smell like anything. So it's a process of purchasing them and maybe testing them out and seeing if they have a flavor, but that's something we're trying to work on as well.
I think that's gonna be sort of a cat and mouse game between the tobacco companies and the bodies like us that try to do enforcement, and, what's a characterizing flavor.
Mhm.
And I was reading the other thing about the Zyn Clear, or maybe not Zyn, but other ones that they're called Clear, but they do have some kind of characterizing flavor.
Mhm.
And then where do you draw the line and how do you determine that? So I think it's gonna be a challenge, but I think if we have the Zyn Chill has already been declared a product that has characterizing flavor, and characterizing flavors are prohibited in Needham. I think that's a pretty easy argument to make to our retailers, and
Yeah.
I think that's that would keep us in compliance with the rules that we already have in place.
Right, I'm seeing, kind of consent for that, right? So
I
the
think
chill
so.
issue, we're gonna say, yes, let's pull that, right?
Okay.
Okay,
Need a motion.
I don't know that we actually need a vote on this. This is more interpretation of regulation.
Right.
Yeah.
Okay.
Nicotine content. So Zins have been approved by FDA in 3 milligram strength and 6 milligram strength, which is all they actually make, at least at this point. And I guess you're saying there are other brands which have not been FDA. I don't know of any other brands that have been FDA approved that have, far higher nicotine levels. So we could just say, we limit it to 6 milligrams, and we do it on the basis of the FDA saying that they've authorized up to 6 milligrams thus far. So we're comfortable with up to 6 milligrams, but no more.
I agree with that.
All right.
I agree.
Yes,
You know that?
sorry.
All right, so limit to 6. Okay. So, advertising we can't do. So the final thing is just the QR code, and how people feel about that. I mean, theoretically, youth are not able to purchase this. So this is, adults, purchasing a product that's FDA approved and maybe used for smoking cessation, maybe. I mean, the FDA, obviously has their qualms about that as well, and they said they're going to be monitoring it pretty carefully.
Yeah.
But how do people feel about that? Is it an end run around a coupon, or is it something different?
I think it's an end run around coupon, but I'm not sure.
Yeah, I'm unsure a little bit on this one too.
I think it'll be difficult to enforce. Are QR codes protected under First Amendment? Maybe they are.
That's a good question. I don't know.
And, if you can, maybe instead of QR code, you can say, when you leave the store, go to this website and get free merch. I could say that. So
Right. Either one.
One of the staff online, Jen, did you have a comment?
No, apologies, that was just an error.
All right, so we're gonna,
There should be.
yeah, so we're gonna allow the scanning of the QR code then. Maybe we could say that this, we can, doesn't matter if the store does it as opposed to the individual doing it.
Mm. Sure, we could get more information on it if you want, like do.
Like how it gets used and
how
how,
it gets
yeah,
used.
Is that something we can also monitor, like when we do our?
we could do a separate compliance check about it, yeah.
Right.
It's turns into a coupon. Which that, that could easily happen.
Okay.
Then we could revisit this.
So it sounds like that's a more, let's get a little bit more information, see what the use is and revisit it.
Sure. That
Okay.
works.
All right. I think that brings us up to Carrie and Foundation of Public Health Services. Carrie online.
Like the motor defense.
Okay.
Hey, Terry.
Morning, everybody. How are you? I'm sorry, I intended to be in person with y'all, but needed to be home. So thanks for giving me the time to do this. I don't do you want me to share my screen with my slides, or how would you like me to proceed?
I think we all,
can
I think
share
we,
your screen.
yeah, either that or we all have the slides in front of us anyway.
Okay. Cool. I see the packet coming up. So while, oh, great, thanks. So this is a chance to talk about foundational public health services and an assessment process that's happening with all of the shared services organizations in Massachusetts, which is 51 of them at this point. And there's been a lot of talk in our office in shared services talking about foundational public health services. I'm going to say the word services a lot. I apologize in advance. And we thought it would be worthwhile to take the time to kind of share this information with the board, talking about how are we assessing this? Why are we assessing it? And what's the impact going to be for local public health? I have a few slides, many of which I've borrowed from the Department of Public Health. Thank you. And I want to walk through some of this, and then if there are any questions, you can ask me along the way. So the Foundational Public Health Services were released by FAB in, Public Health, accreditation body, in 2021, and it was part of an effort to kind of align the 10 essential services, the foundational public services, pull in more content areas than you see if you remember the 10 essential services and that wheel and our 3 core competencies of assurance, assessment, assurance, and policy development in the wheel. That didn't have content areas as much. It was more focused on capabilities. So the foundational public health services were released trying to reconcile that there are both capabilities we need to have and there are content areas that we focus in. And what they do is they identify, as you can see on the slide, so there are 5 foundational areas, and these reflect the minimum level of services that should be available in all communities. So it covers each of these content areas. So there are these 5 foundational areas. There are 28 associated headline responsibilities. Those of you who have been, I know you've all been following the accreditation process, and FAB is the author of accreditation as well, right? So some of this, you might recognize some similar structures. So 5 areas, 28 responsibilities distributed among each of those 5 foundational areas. Next slide, please. And then there are the capabilities. These, they're cross-cutting because they're skills that may apply in each of the content areas, apply to at least 2 of the content areas, and are things that need to be considered and incorporated in the work. So this is more how do we do it? What do we need to know and be able to do in order to address issues of, for example, access to clinical care or maternal child health questions. So these capabilities are actually embedded in the in the accreditation standards. So there is linkage across these different measures and ways of assessing public health practice. I know they were trying to really make it simple, but it's a little complex. Anyways, so, I mean, you can see these foundational capabilities, they're familiar, they're straightforward, our work, and that we are doing this all the time. We're engaged in partnership development with different organizations in the community, with our colleagues in other parts of municipal government. We're always, enhancing in the organizational competencies. We're working on, with you, thank you, policy and development and support for each of these foundational areas. And we're also working on the accountability and performance management. So we're always practicing in each of these areas. It's pretty familiar. So what we're doing is, right now, Massachusetts is adopting the foundational public health services. They are not not like the Mass General laws that we are required to follow. Those are codified. These are the standards that are generally accepted across the country, and there are 22 states that have adopted them. And Massachusetts is in the process of doing that as well. So one of the first steps you do when you adopt them is you look and see, well, how close are we? Kind of like what Lynn did in preparing us all going through accreditation. It's, well, what do we have strengths in, and where do we need to build activities, build our capabilities? So that is what this assessment process is that we'll be going through. It started officially, there was a kickoff meeting, I think, in January. And there's going to be some work that each of the communities in those 51 shared services groups need to complete. We just had our meeting with Tim the other day to talk about, to show him the tool and talk about how Needham wants to go about completing their portions of this. Next slide, please. So here you'll see, these are kind of the reasons, what do we get from this, the so what. We'll be able to support data-driven decision-making. That's something that this board is always focused on, and we will have data. We'll have even more data about our own practice in each of the shared services communities. We'll have about the aggregate performance for the collaborative. We'll be able to increase accountability because there'll be a common structure, and we can look at progress, we can look at outcomes. I think one of the neat things that I see from this is that it will be should be more apparent to the general public and our adjacent colleagues. Everyone says public health is something different. And I think this will be really nice if we all can point to this common set and say, here's where we are, here's what we do with it. It also will support capacity building because we'll be able to be real clear with pipeline development and indicating what are the roles, what are the needs, what are current gaps, so forth. And, always it provides opportunity to make a case for funding opportunities. If we can clearly say, look, we really ought to be able to do this. It's designated as a priority. We can have a thoughtful conversation about is it a priority in our jurisdiction? And then go about seeking funding to support it. And that may be, I know the state may be looking to provide information to the legislature about what a public health system would look like. But we can use the information for grant seeking and the like at the local and the shared services level. Next slide. Okay. So everything always comes back to the blueprint for public health excellence. And the reason I wanted to share this slide was really because I liked the quote. The goal of we need to have clear, comprehensive, uniform, and quantifiable goals. And that's what the adoption of the Foundational Public Health Services does. It covers those, and it gives us the opportunity to elevate standards, see where we are with the standards and what needs to be elevated and where we're performing really well. So I am all in on the yes, everyone, let's have some clear, comprehensive and quantifiable goals. Next slide, please. Okay, so this assessment process, in order to get to this place, there are two tools, and there's an asterisk because there's a third one, just in case. The first one is the cost tool, and I'll show you what it looks like. And we'll talk about what we'll be collecting in it. And this is just about dollars. What's the operating fund budget? Are there revenues that come in from directly to the public health department from activities, from inspections? Some communities do have fees come in directly to them. So we'll get a clear sense of what is being spent. The second one is a service delivery tool, and it uses the structure of those content areas and the capabilities and runs through a series of questions asking, where are you on, do you provide these? Do you share them? Does somebody else provide them? Is there something that the collaborative, say, has decided to do on behalf of all 4 communities? And then also looking at our staffing patterns and whether there's, we have, it's in the emergency preparedness world, we say staff, stuff, and space and systems. So it's do we have the staff that have the expertise? Do we have the capacity, the right equipment, the space, etc.? The asterisk there is the ISD tool. It's Inspectional Services Divisions. Some communities, as I think you may be familiar, some communities, the inspection functions are in a separate ISD division. That's not the case for any of our 4 communities in our shared service arrangement, but some shared services groups do include communities with that. So we won't be completing that, but there is a means to do that for other communities. Next slide. So cost tool. It's pretty extensive. There's a section for what are all of the inputs that you have for the budget to do the work. Then we are compiling, and that's a kind of a royal we. Jen Casey is taking the first pass at this for us for Needham and Shared Services in gathering each role. So we're not looking for. We're not going to say Carrie Janelle and what I get paid and so forth. We're going to say my role as shared services manager. And the information gathered is, what's the wage or salary? Is it a benefited position? Is it a represented position? Is it, what's the full-time equivalent that the position is at? And we go through that for all staff, including any paid interns, any seasonal help that we have, as well as any hourly contractors, which we don't actually have any in Needham or on the shared services group right now. Then we'll also be gathering information about, are there any services, they asked me, are there any services that you either pay out, you pay someone to do via contract, or you receive funds to do. So that's where my work, shared services and training hub would come in. That's where the substance use programs would come in. We do not have any contracts to provide services to anyone else, so we wouldn't reflect that. But what we'll have is a big, beautiful Excel, pardon me, spreadsheet that has all that info, so you can see where the department investment's going to serve the different public health those capabilities and those foundational areas. Next slide. Then there's the service delivery tool. And this is just a screenshot for you, a clip shot of the sort of the header, the instructions for it. And what we run through is every one of the those foundational areas. There are questions about what the nature specific to that foundational area. What services do you provide? And does your organization provide it? Do you not provide it at all? And one of the things that I think is greatest about this is that we're also kind of quantifying it's not just a yes, no, right? There's gradations to it. So you can see in the let's see, there are 3 columns on the right-hand side, and there's a grouping of capacity and expertise. So for capacity and for expertise, you're asked to rate the service that's delivered, and there's 4 choices. It's absent, so you're not doing it at all, or you don't have any staff expertise in the area. Absent, comprehensive is the other end, right? And I think that in in Needham, a lot of the services will land in the comprehensive area. We're fortunate to have such a strong department. And then you can also say you have limited capacity, limited expertise, or you have moderate. So there'll be a four scale ranking there. So you can get a good sense of, oh yeah, we've really got environmental health inspections covered. We're good. We've got high expertise. We've got we've got strong capacity, but maybe we need a little more support in communications work. And I am making these up. I have no insight yet into what the actual results are. I know our environmental health is pretty great though. So, so this extensive tool will be running through. So how this is going to happen is shared services and with support from a contract that the state has with BME Strategies. They're providing a strong support for communities in running through all these questions. We have an individual assigned to us. There's one assigned to each shared services group, and they're available for questions about the tool, sort of nuanced questions, because they've worked with it a lot. I'm working with this. I'll be working with each of the communities, and Amy McInerney is going to be joining me on it. So, we will get a little bit more well-versed in it, and it'll be helpful, I think, for the communities to have us present as somebody that they're familiar with. So, next slide. And then the last step is that we will roll back to the cost tool, and we will look at each of the roles, each of the positions that have been listed in that chart on the cost tool. And we will talk with the towns and determine what percentage of time for this role is spent in each of these areas and in the capabilities, right? So the work may be heavily focused in environmental health, and what percentage of time of that environmental health work are you focusing on building organizational competencies, for example, the training work and the like. What percentage of time is spent on assessment and surveillance, and that will vary based on the different programs, and will reflect what the actual level of effort is. Again, so you provide a really comprehensive picture of what each participating department can do. And next slide, please. So then this is just some little guidance we've been given on the how to do this. I think that we follow these practices pretty well as a general rule with our work, but you know, it's a reminder to not just sit in the room with one person and have them, you know, assess it, but to do diverse perspectives, incorporate diverse perspectives. So Tim was, one of the questions we had for Tim the other day was, you know, how are we going to group folks for this? You know, do we want to use maybe a staff meeting for it? Or are we going to do another meeting? So a little bit of organization strategy to make sure we get the voices in for each of the areas. And then a reminder that this isn't, you know, it's not a math test. It's a best judgment. It's, you know, what's your best sense of what this is, and that this is not, you know, it's expected that there will be gaps. It's expected that there will be areas where performance, you know, where the capability maybe doesn't exist at all, or where you know, there's very limited work being done in one particular content area. And it might be because of, you know, the way public health is defined in a community. It might be because there just isn't enough, you know, there isn't enough funding to address it. So it's not, we don't want anybody trying to answer to make sure that we get 100, because it just wouldn't be true. And it wouldn't be helpful either, because, you know, we know there's places we need to grow. There's always places, and this will help guide it. And there are technical assistance resources that we can use. As I mentioned, there's the individual we have assigned to us, Manize, is a great resource. And then there's some also documentation. And then when the slides, sorry, I just lost the slides. So I think the next slide is, there we go. Right. So I just wanted to come back to how is this going to benefit public health, right? We talked about this slide at the beginning. What were the aspirations for it? I think my goal was to, you know, demonstrate, and through talking about the tools, kind of how we actually would be achieving those things. You know, I think you can see how the capacity building will be supported by, you know, knowing what are the results for a particular content area. As we look at pipeline for the public health workforce, it's important to be able to describe to education groups and to recruiters, sort of, this is where the work is going to be. These are all the things that need to happen. We'll have a much better handle on that. And all of this will be used to increase, you know, we can be increasingly accountable and share the information with the public broadly of here's where we are, here's where the 51 shared services arrangements are in terms of meeting these foundational public health services, this minimum level of standards. And I think, I guess then the next question is, okay, how is it going to get used? What does that application really look like? So at the end, the state is going to be given a comprehensive report that shows the results. There's not reporting at the individual community level because, you know, this is all part of the shared services work. And, you know, the goal of shared services is to elevate the provision of public health services, not necessarily in each community, but for each community, right? So by working in a collaborative, it might be that a community just doesn't have the capacity to conduct certain types of inspections. We've often talked about Title V and how, you know, there's a limited amount of that kind of work in Needham, and the great value there is to have access to other folks in the other communities who do it much more frequently. So we're again kind of working that level of how do we elevate our group so that all the residents and businesses in all the communities have access to the best public health services. You know, it will look a little different everywhere. And I think actually next slide, I have an example slide of how this information was used, or one of the pieces of work that was shared with, for the state of Wisconsin. And, whoops. Sorry, slides dropped again. But for the state of Wisconsin, you can see that there was a shortfall. There's a gap. Here's the spending, and there was an estimate of what the total dollar amount that would need to be spent to fully deliver all of these tools was 245 million. And the red shows what the estimated actual spending in 2022 was. So that's that's a big scary gap, and that's there because there will be gaps like that in our results. But what this enables us to do is dig into the gap and start a conversation about how do you go about filling that gap? What are the resources that are needed? What would it look like? Is this something that a shared services collaborative takes on to fill a gap? Or is it something that maybe two collaboratives work on to fill a gap? So just an example of how Wisconsin did it, and also a visual reminder to folks that there will be gaps. And next slide. So time frame for this. Right. So time frame for this fiscal year, this current fiscal year, we're doing the data collection. That information should be back up and complete in report form to the state, and then will be shared at a shared services level. The information in May is the target time, and the results of that will actually be used to guide some of the work plan work. What the work plan will need to look like for the shared services group for the coming fiscal year. So we get deliverables from the state, and we work with our advisory board to make sure that we're working on deliverables that agree with their priorities. We'll now have data to match up with those priorities. We'll also be doing further planning on what does it look like to try and fully implement these foundational public health services during the next fiscal year. And then the goal is that there would be beginning implementation in fiscal year 27. And, don't know what that exactly will look like yet, need to see the data, but that's the time frame for this. So lots of information available by the end of this fiscal year. We'll be able to give a nice portrait, and shared services managers are required actually to go back to each community and report the results for the collaborative they belong to. So I'll be back to share where Charles River is, and talk a little bit about the variations. And that is the end of my presentation. I had a fun little pile of question marks on a slide there, but I think y'all can see it. So I don't know if you have any questions. Happy to try to answer them or take them back. Thanks for listening.
Any questions from the group?
I have a question.
Yeah, if we could turn the volume down, this is quite loud.
Sorry.
Okay.
Hi, Ken. Going back to slide 1, just really about maybe definitions. I can see the 5 foundation areas.
Yep.
And 28 associated headline responsibilities. That has those, I assume those 28 things have already been defined, and I'm just wondering, like, we do a lot of things that I don't specifically see in the foundation, although I can see where they might go, like mental health into clinical care, substance use prevention, maybe into family health, epidemiology, into communicable disease control. Is that what's meant by the other responsibilities? Just wondering what things.
Yes, great question. Thank you, Rob. The 28 is, and I'll back up and say that before this assessment tool was released for folks to be working with, it was reviewed by folks at the Office of Local and Regional Health and representatives from local public health all across the state to make sure that the headline responsibilities, matched what Massachusetts public health practice is. So it gets into, there's, 6 for maternal child health, there's 7 for environmental health, right? And they're specific, and yeah, they were validated and in some ways adjusted to reflect Massachusetts public health practice. I just didn't want to, it would have been a very long, it would have been a much longer presentation if I shared all of them for each of the areas. I figure I'll save that for when we have some data. But I can provide a link if you want to look at the assessment tool.
Sure, that would be great. Thank
Hey.
you.
Happy to.
Right.
Is this a one-time snapshot of data that we are collecting? Or will this be collected year over year, and the idea is to project over the long term as well for cost and capacity?
Yes, so, sorry, yes to the second. So the idea is that this would be, regularly collected. I don't know the plan for the intervals, but there'll be some, there'll be some means of reporting. There'll be some requirement for reporting and sharing progress on these different areas, and have you changed your staffing expertise from moderate to comprehensive because someone achieved a new licensure, things like that. So yeah, the intent is that this would be updated, and it would provide a regular view for folks of where we are and where we're headed. And as staffing changes, capacities will change just naturally. So it'll be helpful for that. Yeah,
Right, thank you.
thank you.
The next item on the agenda is a brief preview of the customized permit fee calculator.
Correct.
Our team has worked with a contractor for, I think it's been almost a year, to look at the fees that we charge for permits and licenses and the amount of time it takes to provide that service, from both the processing of the paperwork to the conducting of the inspection, and any follow-ups and that sort of thing. The state regulations say that permit costs are supposed to you sort of not be kind of, for lack of a better word, a sin tax on things we don't like, but it's supposed to accurately reflect the cost of providing the service. That doesn't mean that we can't subsidize the cost. It just means we shouldn't overcharge people. We have a sort of a dynamic model that we'll have presented in full at the board's meeting in March. And obviously, as you tweak the variables, the exact numbers change. But the pattern through the first, iteration, which does take into account a lot of sort of soft costs, like, fringe benefits for staff, IT charges, IT equipment, etc. We appear to overcharge for things like some marijuana charges and some tobacco permits, We undercharge in some cases dramatically for food service permits and for biosafety. So one of the questions that will come to the board next month, it could be decided next month, or it could continue longer if the board wants, is what to do with the fee level for fiscal year 26, which begins July 1. I presented a version that has, and the green is essentially, there is more revenue that would come in, and the red is less revenue would come in if we accurately reflected the costs of,
So you multiply this out by the number of permits for each category, what's the total change?
we can do that. We haven't done it yet.
Okay.
I do think, that changing, a small restaurant with less than 50 seats from $250 to $660 seems like a jarring change. Reducing the cost of tobacco from $700 to $350 maybe is more accurate, although the tobacco permit fee calculation does not include the costs, Tara and Sai, please correct me if I'm wrong, of providing the compliance checks. So
Sure.
it actually would be a lot closer to accurate when we
Yeah, but that should be put into the calculator. right?
Where is that cost now? Like, which bucket is that in?
It's
So-
a mix of our time and our
Yes.
staff time and
Yeah.
police's
Yeah.
time. And the police are often on overtime when they're doing it.
So I think there's a cost.
And
of
we're
that.
paying, and we're paying the police for their overtime cost to do this.
Actually not, they bear it out of their own budget as part of what they think is their responsibility to the town, which is generous, obviously, but.
But we should build it into our budget at least.
And we do give the student a gift, $50,
Card as well, and that's not included.
not included, but
So, you know, I think that jumped out as a sort of a dramatic overcharge, but when you dig a little deeper, it might not actually be an overcharge at all.
Yeah, the other thing that just seems a little weird, just in terms of, face validity for this, looking at retail food establishments by square feet. You'll see that, the proposed new fees go from 180, as you get a little larger, 360, and then drops down to 120. And then
Yes.
300, and then finally the largest one at 360. So food establishment greater than 10,000 square feet being the same as 1,500 to 3,000 seems a little odd.
So I noticed that too when I was putting together the packet. I did ask the consultant that helped put together the model. And when we get an answer back, I will ask that because it just,
Okay.
it seems like if it is all the same, why does it go down between 3,000 and 6,000 and then start to go back up? I don't understand how the volume of work would be less in that way.
Correct.
I could maybe sort of answer that. So like, we have like a risk-based schedule for our food establishments. So some of the larger facilities are lower risk, so we go there less frequently versus some of the smaller facilities might have a higher risk level. So like those numbers are based on staff time in terms of inspectional frequency I think that's why there's a variance there.
Fair enough.
Just a couple thoughts. One is that some of these changes, as Tim said, are pretty dramatic, not everywhere, but I think this is definitely gonna take some communication. So, especially retailers understand what's going on. And, for some of the really big changes, like food service less than 50 seats to, jump up to like 2.5 times. Maybe that should be a phase in rather than a sudden jump. Because, there are some places that are gonna be very happy and other places that are gonna be
Yes.
less happy.
There's a requirement not to overcharge.
Right.
There is not a requirement to charge accurately the exact cost, so the town can always choose to subsidize.
Mhm.
Because it thinks it's important to, have vendors at a farmer's market providing
Mhm.
nutritious food, it can always charge less than the cost of providing the farmer's market permit, for example. But that would have to be a sort of a policy judgment by the board.
Right.
Certainly, I do think if we are interested in coming close to what accurately reflects the time, I would suggest a phase-in period of 2 or 3 years, and I would
So,
say we have to do a good job communicating why this is happening, what the change is.
yeah, and then also, after a year, kind of, we'll be running these numbers and, maybe we'll find that there's a change in what it costs to.
Yeah.
Yeah, but just in terms,
Evaluate the less than.
Yeah.
Service.
in terms of the department budget, I think you need to, again, multiply this by the number of permits.
Yep.
Because I doubt that it's gonna have dramatic change, but it might.
Yep.
We
We can
need
do
to plan
that.
for that.
Absolutely.
Okay. Very good. So now moving on to staff reports.
That's great.
All right. And we have. That's it here. We have 2 months worth. All right. Starting with environmental.
Alright, do we want to start with?
We could start with December first.
You can do it, you can do them combined. A lot of these things, just roll
Yeah.
over. So do it topic by topic.
Sure. So we got an update about the rice barn. It sounds like the tenant has left the space and they're looking to find a new tenant to move in. I think there's interest of it continuing to be a restaurant. So once we get more information about who might be moving in, we'll probably get a permit for it and move forward. But I think that's great news because it was on hold for quite a while. And then in December, we had when we adopted the new nicotine-free generation policy, we had done the outreach to all the tobacco retailers and developed and had them post new signage for that. So that's up and running. We haven't really gotten many comments about it so far. we could, I'll check in with them when I do the next retail inspection with them, and we'll eventually do a compliance check to check that sometime this year. And then that's like the only big updates for the month of December. And then and we also had adopted a new dumpster regulation, so we created a new online permit for that. Did some outreach with that. We're trying to get this word out through multiple channels to see to get applications in. I think we've so far got like 20 to 30 applications in. We're reviewing them and giving them comments. So so far that's going okay. We're the hope is try to get most of the dumpsters permitted in town by the summertime. That's when like past complaints will go up again. So I think that's the goal I have internally, to try to get those most of the dumpsters in town permitted by that summertime deadline. And then
Yeah, I can give a quick staff update. We did hire an intern that will be starting with us next week, Monday. And she will be working with us on some of our FDA standard work, as well as the dumpster regulation work, which will ramp up this spring, I'm sure. So that's exciting. She'll be doing 15 hours a week for us. So that'll be helping us.
Have you gotten any feedback from the people who are gonna be having, get these permits, what they feel about having to do this?
We had one feedback on a dumpster concern this week, actually. One of our food establishments expressed a concern about the cost of having to, because they had submitted a permit for a trash dumpster, and we had said, well, we need a recycling as well. And we gave them some options on, they could get smaller toters, but I guess their hauler did not have that option, so they had to maybe switch haulers. So they were concerned about the cost of that, but that was the one that we had gone,
Only one, though, not a big uprising.
not that I'm aware.
yeah, maybe 2 or 3 have
Yeah.
complained about it. So just kind of convincing convincing them over a period of time that it's being enforced across the board. It's not we're targeting one place over another. But like through this process, we're also enforcing like Article 2 about making recycling mandatory in some of these places. And that's the extra cost that like that might be a burden to some of the small businesses. We're trying to work with them to figure that out. We're also working with the planning board, because the planning board had decisions about like where dumpsters should be located as well. They kind of want them behind enclosures and public parking lot areas. So we're also like working with them on those issues as well.
It becomes a shared area for all the establishments around that parking lot, for example. Like the one over here on Chapel Street block,
Yes, yeah,
shared by
it's shared by multiple, and it'll be one permit for all of them. Yeah.
one permit.
Yeah.
Okay.
I do think it's something to consider in the context of permit fees as well, right? This was a new fee that was added unexpectedly in many cases. Well, to a number of establishments, but especially food service establishments. So if we are adjusting their fee, we should potentially take into account that they just had another permit charge added.
Sure. You said one permit, but I mean, how do multiple businesses hold one permit? So if there's a violation, who's responsible?
It would be the permit holder for, let's say it's a shared dumpster, it would be the permit holder for that shared dumpster.
But you just said there are multiple.
There are multiple
people
businesses using
holding
the same,
permit.
it'll be multiple businesses using the same dumpster, but we can only issue one permit for that dumpster, right?
Yeah,
So
okay.
maybe the fee should change, because right now it's a flat fee. So let's say it's one business using one dumpster, they're bearing the cost of that flat fee, but if it's multiple businesses using a shared dumpster, it's the
Mhm.
same fee. So maybe that's a decision to be made about fees
Not
schedule
just
there.
the fee, but if we have to assess a penalty for some reason.
Yeah,
Yeah,
You know, who bears the responsibility? You know, it's got.
I can see all kinds of disputes arising over who did what.
Mhm.
Yeah, it's the tragedy of the common situation. I know
Yes.
that the planning board prefers shared dumpsters because they take up less space and there's more room for parking, but I think we find that shared dumpsters can promote pest challenges.
That's why, so I mean, just be, careful as they're, creating these shared groupings, that they have some sort of prearranged agreement as to what's gonna happen if there is a violation.
Mhm.
As
Maybe
opposed to
they should fully share the cost of the violation. I don't know if we could probably put that in the regulation, but
Yeah, Yeah, the way that I was,
No, but we could
Envisioning,
suggest it to them anyway.
yeah, I think the way I was envisioning doing enforcement was, like issuing the fines against the permit holder themselves.
Mhm.
It's one permit holder. That was one of the issues with the shared dumpster arrangements was
Right.
that they would point fingers to one another and we couldn't figure out who was the responsible party, so it's impossible to issue fines.
Right, so you issue a fine to the permit holder can assess that against everybody else, and if they say, we don't want that, it's fine, you're not using our dumpster anymore, get your own.
Yeah.
You know, so that's probably how it'll work out. Okay,
Could you give us a quick Vernon update, like the rats specifically? You know, we had a constituent from the preschool who came talking about the rats at that facility, and I'm just wondering if we had any more sightings, complaints. Or
Yeah. So we did witness, we had Keolis do a gassing along the train tracks behind along Highland Ave behind the Dunkin' in town on Highland. And that went well. We like watched them do it. They did it across the whole tracks, so we think that was effective. Over the winter, we haven't really gotten the many complaints of the last few months or so. We have like smart boxes that are out and three different parking lots in town. One of them is by that daycare center, and there weren't there's only one capture over the period of like 4 months so far in those boxes. So I think the activity levels have dropped down. I think it's due to the very cold winter we've had so far.
Have you had any evidence of rats in the railroad embankment behind Roach Building on Chestnut Street?
No,
Because I saw you,
no.
somebody found a rat on a warrant.
Yeah, so I'm aware of a population that's nearby there, but I don't think it's along the train. I'm not aware of any population on the train tracks behind Roach Brothers.
anything else? Okay. Accreditation,
So Lynn isn't here, but I can share briefly. We did submit all of our materials to FAB in December. We're waiting to hear back. We expect in March with a list of comments, questions, and a chance to make some adjustments to the written materials, with the expectation that there will be an in-person visit and sort of review sometime in May.
okay,
We are continuing to work on quality improvement and performance management and to develop policies and SOPs.
very good. Questions about that? No, moving on, traveling meals.
I can give a quick update. So the only update Rebecca wanted to share is that in December 2023, there were 10 more clients than now, so like 55 versus 45, so it dipped a little bit.
Mhm.
But other than that, there hasn't been any major changes or issues. We've been getting through this ice storm issue pretty well this past week. We were nervous about that, but we've been troubleshooting with clients and making sure they had safe walkways and things like that, so.
Good. Okay, moving on, substance abuse, part 1.
Is that me?
Yes, Carolyn.
So over the past couple months, we've continued to work on implementing our regional strategies that we identified in our strategic plan. Specifically, we've been focusing on a health curriculum strategy, to health education programs for youth. Alcohol education, Safe and Smart is an alcohol program for high schoolers. And then Stanford University has a program called Smart Talk Cannabis Prevention and Awareness Curriculum for middle schoolers. We met with a representative from each of the programs to learn about it and learn how we could support the schools in taking on the program. And then we've had meetings with school K-12 wellness directors and health educators in 3 of our 4 towns so far to talk about the feasibility of them considering these programs, adopting them into their curriculum, how we could support them in doing that. And we're still working on scheduling with our 4th community. 2 of the schools that we met with so far already use the alcohol program, and we're hoping that we can support the other 2 schools in adopting it. There are a lot of state framework changes with the health curriculum and wellness curriculum now, so the timing is a little tricky, but we're hoping that we can help them just take it on in some capacity, would make it as easy as possible for them. We also, Carol and I, worked with a graphic designer who we worked with in the past to create this brochure that we're having professionally printed. I just printed one on our office computer and folded it, so it's not super professional, but when we have them professionally printed, I'll bring some of those in as well. And then last month, we attended a planning retreat in Westwood. The health director and director of human services, who we work closely with through the grant, are applying for a drug-free communities grant, which they haven't had before. Then they would have their own prevention full-time staff person that we could partner with. So we've been working on supporting them and building their capacity that way. I don't know if there's anything else Carol wants to add. That was all for me.
Thank you all. Thanks, Lydia. I would add two quick things and thank you. We're grateful because the work that we did with the town of Walpole, and they were awarded their drug-free communities grant in late August, early September, and they just hired a full-time coordinator who started this week. So, you know, our goals of our regional grant is to build prevention capacity and reduce underage substance use. So between the last regional grant and this regional grant, we just have that one more town to help, which is Westwood. The challenge with Westwood, our former town manager was at the retreat, and all the pieces have been in place, but with the administration changes, the 2025 application schedule to be released was paused. So the decision is to continue moving forward, because we expect, with the commitment, bipartisan, and the longevity of the drug-free community program, that the new application will be dropped, if you say, soon, so that people can apply. They'll be ready. Westwood will be ready. They have a really good application in preparation, and the retreat was powerful. There were about 22 stakeholders, so we're proud of them. Jared Orsini is the health director. The last thing I'll say is, like all of you, we've been monitoring. We are paid by a federal block grant, the treatment block and prevention block grant, and it was paused and then reauthorized. So at this point, we've been working closely with Tim and BSAS, and there are funds available to continue because the block grant gets prepaid most. So this fiscal year is set. However, BSAS will be in the process of reconfiguring our next 2-year contract. And as you all know, they doubled our allocation with ARPA funds, which is why we have 2 FTEs. So this July's contract should come out soon, and we were told to expect to go back to the original award of $125,000 a year. So we're prepared for that, staff-wise and change-wise. So I just wanted to keep you updated on that we appreciate Tim, you know, communicating with us with BSAS, but we're confident the funds are there to get us through the end of the year. And as our grants manager said, they're moving forward with the new 2-year contract, business as usual. And we're trying to be positive. So thank you all always for your support.
Aaron Shannon's not here, so I'll give.
Before we get there, just a couple of notes. One, to your point, Carol, I actually met with Auchincloss in his office in Washington last week, and I brought up these grants. So it's definitely on the radar with the congressional delegation. Another thing, just in the report, I don't know which, actually it's well, I guess it's in Karen's report actually. So I guess we'll go to that, because I'm just seeing something here that's looking, you know, a lot like advocacy, but it is on the Stop Act grant. So let's pull it up.
Sure. So I have the talking points she gave me. I'll go through them and then try to answer questions or take questions back. So in January, SPAN launched the Conversations with Your Middle Schooler, Why You Shouldn't Wait to Talk About Substance Use. as a 3-part series for parents of 5th to 8th graders. It's based on Samson's Talk They Hear You material. Increase awareness about underage drinking, other substance use, provide skill building techniques for parents to have conversations with their kids and build a connection with other parents. There's been about 10 parents that have gone through, that were at the first session. So that's been a positive thing. The peer recovery coach in December and January worked with 6 individuals. She continues her oversight of the Dual Recovery Anonymous weekly meeting. So that's a 12-step program for individuals who have experience with both an addiction and a psychiatric challenge. Mutual support community uses a harm reduction approach towards wellness. The attendance is modest, it's 4 people per week as the average. But we are, only 3 months into it. It started in November. We think that's a positive thing, a very positive thing though. The STOP grant, the staff hosted a responsible beverage service training in December. 16 attendees from 7 Needham businesses. It was facilitated by 2 new instructors. So Austin Broderick and Sarah Timmerman from Needham Police. And in the report, there was the alcohol compliance summary. Youth mental health first aid, Karen Shannon working with Youth and Family Service Director Sarah Shine, co-facilitating training for 15 members of the Needham Resiliency Network. And almost 50 SALSA students completed almost 200 hours of service. A refusal skills presentation to Pollard 8th grade students, an alcohol policy day at the State House with youth advocacy hosted by the Massachusetts Alcohol Policy Coalition, and a youth power summit in Worcester hosted by Mass DPH and the 84 movement on tobacco cessation.
Okay, very good. Yeah, the one comment I just had on the Stop That grant in the notes here. That grant cannot be, we're allowed to educate but not lobby.
Correct.
It just sounds, if you read the report, skirting the line there, because we help students, promote a tax, advocate for a tax. Educating them about, the tax and, letting them do what they think is right is fine, but it just can't seem like we are, in some way behind that. So I just wanted to call that out a little
Can I
bit.
work with Karen to clarify that?
Yeah. And also, I saw you have the stuff here from the additional data from the Metro West Health Survey. One thing that Congressman Auchincloss did bring up is gambling, which I don't think is something, I don't know if we asked about that. We do, all right.
That's new, sort of newish additions to the survey.
Good, okay, because he would love some data on that. He sees that as a huge and growing problem. And I didn't know off the top of my head if we were collecting that at this point, so I guess we are.
Yeah,
So
we do have a
that's
couple
great.
of, it may be new, it may have been new to the last year, but if not, maybe 2 iterations of the question. And we did actually have some sort of interesting, unexpectedly high levels of gambling. Actually, middle school students was higher than high school students, which was even more bizarre. But we absolutely do have some data that we can provide.
Yeah, but once we got into this whole thing, I mean, his face just lit up and then, and went into the gambling thing. It was like, oh my goodness, okay, we should be on top of that.
So we could pull some Needham and regional data and send it to you. Follow up.
Yeah, I'd be happy to take it to his office or we can do that as, as a department.
Sure.
I also wanted to say, Stephen, that our former TA provider, Ben Spooner, is running the gambling prevention unit, and we can connect you with him and the work they're doing. As you remember, BSAS paused our regional grants for having TA. So Ben moved over to the gambling prevention team, which is really comprehensive, and we can send you his contact info and what they're doing for Auchincloss as well at the state level.
Okay, yeah, I just want to make the connection, that's all,
No,
the
it's
more
great.
the
Appreciate
more that
you
he
being
sees
there.
us as helping his problem, the more he's gonna, help us, so.
Good, awesome. Thank you.
Does the Metro West Health Survey collect any information on gambling?
So that's,
So
I think what
that's
Julie
what-
was referencing. So it was either the 2023 iteration or the 2020 and 2023 iterations. So it's a new question. It doesn't go back nearly as far as we have the data on like.
Yeah, because
alcohol.
I thought I had seen some data on that collected by different age groups,
Yep.
and that must have been the source of it.
Yeah. Yeah. So Julie will pull more Needham specific and in comparison to regional data.
And send it out to everybody, like us.
Yeah.
Yeah.
She'll give it to me and I'll send it to all the board.
Okay, fantastic.
Any other questions on substance use? Karen's report? No, okay. Moving on, emergency preparedness. Khalid.
Good morning, everyone. So I would like to provide an update on MRC activities and emergency preparedness efforts for December. In December, the NC8 MRC received great news, which is we were awarded the full 10,000 Operational Readiness Award from NACCHO. And this funding will support different initiatives to strengthen our unit. Not only just our unit at Needham, but cover the 8 communities. We also continued working on extreme temperature health action plan, which will help town of Needham and our public health division to guide our response before and during extreme heat or cold events. So this is the 2 keys. And I am happy to answer any question.
Okay, any questions? Seeing none, okay, thank you. All right, Julie, epidemiology.
In my December report, just as a quick biosafety committee update, we actually ended up meeting in January and sort of doing some updating on our annual permit renewal process, because we've been through one iteration of it. We've identified some areas where we can improve. So we're going to be opening up those permits soon for people to do their renewals and scheduling inspections. We did receive notice that one of our companies, Kudo Bio, has closed. They're hoping that that space will be leased out. But I'm assuming that probably won't be soon, just sort of with the biotech climate. So we're down a company. In the January report, I really just want to talk about influenza numbers. So on the second page of that report, I've got a chart. I show sort of I typically show the emergency department visits and hospital admissions in Massachusetts for acute respiratory diseases. But I wanted to focus a little bit on influenza because it's been quite a nasty influenza season. And, you know, we're still on an upward trend for influenza cases, and in Needham, we're definitely seeing it. So far in fiscal year 25, we have had, as of when I did this report, 226 confirmed influenza cases. Right now, we're actually at 260. Compared to, as you can see, previous fiscal years, we've been much lower. You know, in Needham, we do have a much higher vaccination rate than the state. But the overall trend we're seeing is sort of since that peak pandemic season when people were feeling really impassioned to get vaccinated, we're seeing a decline in vaccination rates. I didn't have historical rates going back before FY24. But we're already seeing a little bit of a decrease in Needham, and you can see from the state, you know, there is a steady decrease from FY21 through FY25 in vaccination rates. And obviously there's a thought that there is a connection between the decrease in vaccination rates and the increase in flu cases, on top of the fact that it's been sort of a nasty flu season and the vaccine may have not been a great match this year. But I just wanted to bring that to your attention. And that's really all the updates for me.
I have one question on the, just on the graphs, the MWRA.
Oh, yeah.
Yeah, so that top graph, if you look in December, it looks like we have a bigger spike just before January 1st, right? Up around 3 million or so.
Yeah.
All right. If you then go to your January graph, it's a different scale.
Yes.
that same peak is well under 3 million now, and it's pretty much the same as the July peak. As opposed to being much larger than the July peak as it appeared in the previous graph.
Yeah, that's interesting. This is pulled straight from the state's dashboards.
Okay,
So I'll have to dig into that data a bit because you're right. that
right.
was-
I mean, I don't think it matters that much here because it's like the important thing is, hey, there was a spike then and there's a spike now, right? But in the future it might. So I'm just wondering, what's happening with the software.
No, yeah, I will look into the actual raw data for that and see what is going on there.
Okay. Any other questions for Julie? No, okay, Ginny, public health nursing.
Yeah, so we got a very generous donation from the Needham Community Council towards the gift of warmth. They gave us $10,000.
Great.
Plus we've got 30 gift cards from the Friends of the Traveling Meals and Board of Health. We got 30 gift cards, $25 each to CVS, Walgreens, and Sudbury Farms right now, or Roche Brothers. Because we're finding people didn't have enough money to pay for copays with their medications, so we're hoping to kind of help with them with that, or maybe just some groceries. We also got money for DVAC donations, and we also got money from the Christ Episcopal Church as well for gift of warmth. Those are really the bigger updates. The other update that I have is we are starting to do blood pressure clinics at both Needham Housing Authority locations, so at Beds and Linden and Chambers. I've been talking with Lori, the resident coordinator at the Needham Housing Authority, and our per diem nurse who tends to go, and they both decided that the quarterly visits weren't doing well. A lot of people were complaining that they wish we had more of a bigger presence there on a monthly basis, so we're giving this a try, seeing if we can switch back to monthly and seeing how that goes.
And one of the reasons we switched off of monthly, I think, was because of sporadic attendance, wasn't
Yeah. But then they were like, we don't see you enough, you don't come in, and how am I supposed to know what my blood pressure was from spring, and now it's August, and so we're like, all right, we'll switch
You
that.
can go to CVS and get yourself an automatic blood pressure cuff.
Yeah, exactly, but
But it's
I
good,
think
and it
they-
also helps with connections to other.
No, it-
I was gonna say,
Yes,
it's just like-
exactly.
yeah,
That's what
'cause
it's really good for.
our per diem nurse also teaches about blood pressure, management and lifestyle changes and diabetes education as well, and so she sits down and actually talks to them.
Yes. No, I'm just being facetious, but
Yeah.
in terms of gift of,
pressures at the camp.
Oh, yeah, those are still going on
Yeah.
every Tuesday, yeah.
for the gift of warmth, are we seeing more applications this year with the cold weather?
So funny enough, I feel like we saw more in the fall, not so much in the winter. But correct me if I'm wrong, Dawn, because I feel like I send you a bunch and then I stop for a little bit, and then I send you a bunch and then I stop for a
No, I
little
feel
bit.
like it was busier in the fall too.
Yeah,
When do the utility companies start pressing people to pay? Isn't that late summer?
Yeah.
yes,
Because then they can't shut off anybody's utilities now.
right,
Mhm.
And so they don't bother to press to pay probably until they
exactly,
can shut the power off.
yeah.
There's this pressure being brought to bear now on the utilities over the delivery charges, right? So, if we've seen an uptick over the past couple of years when those delivery charges increased by 30%, it might be good for us as a department to send a letter, to Josh and to Becca saying that, the town is feeling this and, we understand this is in play now. We're looking for some solutions. I mean, we only have so many funds that are being generously donated to, help cover a utility that's making millions of dollars. Okay. Let's see, because I did this in order. All right, so next, well, we kind of did share services, but I don't know, you carry, I guess that's a different report, right? So let's have you back. Sort of the same, but
Yeah, similar but different. Yeah, I'd love to get a chance to talk about the work that our staff are always really busy, and I think it's important for y'all to know. Actually, before I start, if I can just I'll go back to, there was some discussion about advocacy, which reminded me that there is a Mass Health Officers session being offered with, and they're going to give some information about what communications are appropriate and aren't for local public health as you communicate about what the work is and what the needs are. And I think that's next Wednesday, and I think it's open to others, so we'll have that. It's important to be able to share the stories of what the work is, and as you pointed out, Dr. Epstein, kind of make sure that we're following the rules and not crossing a line. So just wanted to put in a plug for that. So as I said, folks have been very busy. I'll start with Charles River. We kicked off our strategic planning process for the collaborative, and we'll be meeting, we're adding an additional month, an additional meeting each month for the remainder of the fiscal year. And there'll be some work with the consultants doing some group interviews and individual interviews with folks to help establish what our priorities will be for this collaborative for the next 3 to 5 years. And we're really excited about that. It's great timing. I'm actually encouraging each of the communities to consider on their own what their priorities are. I think there's varying degrees of alignment and understanding of that in each community. And I think it's just a great practice for folks to know, these are the areas we practice in, this is what we want to focus on. So we will have results of that strategic planning process at the end of the fiscal year. Jen Gangaran, our regional public health nurse, who is a half-time person, she has been providing Maven coverage for Medfield since November, and then actually also picked up coverage just at the very end of January for Dover and Sherborne because their VNA contracts, the VNA was no longer able to provide the service to them. So, this is a great benefit to those communities, and it's also a benefit to Needham because I know in the past, Needham might have been tapping their own resources to provide support for their neighboring communities. And Jen's presence means that that's taken care of. I know she's been working a lot with the school nurse leader in Medfield specifically. And I expect that will probably be the case in Dover and Sherborne as she picks up that work. Then we have, I worked with Jen and we created some pre and onboarding guidance for establishing a public health nursing program in the community. And that was based on work, generous review and comments from the Needham public health nurses. And it was also based on a form that Sam Menard and I had created for the pre-onboarding that we customized to each different role, just to try and provide some structured sense of schedule and priorities, lots of trainings that need to happen. So we were able to share that with Dover. They were very happy. They were preparing at the time for the public health nurse to join them. That person started in February. So that was a good bit of work, and we've shared it with all of the communities because Medfield also has a vacancy, which is why Jen is covering. We completed, all 4 communities completed a self-assessment, which is, they had to do the capacity assessment 2 years ago, and this was kind of, what's the progress? Has there been any change? And I'm happy to say that I think our collaborative, we were at 78% of the minimum standards, and I think we moved up to 85%. And Amy McInerney was working with each of the communities, as it's been a great opportunity for her as the communities get to know her and as we continue to try to support the communities in whatever environmental health needs they have. And that has been happening. There've been inspections. There were inspections in December and January in Needham, Dover, and Sherburne. Inspection related activity. And then, and we also did complete the fee cost study that Tim was referencing after I talked about foundational public health services. That was a project that we did with all 4 communities, so everyone has the information, and it has been valuable already. I know Dover has been using it in conversations with their board, much like Tim was having conversation with you all. And we built some in-house capacity. Amy knows how to use that tool if any of the communities have trouble updating it themselves. Then moving on to Training Hub. So Training Hub it has been focused on development, working with Office of Local and Regional Health in development of curriculum to train inspectors. And Sam has been very busy working on getting herself cleared and then also helping develop that curriculum. She has been training health inspectors in our region, including she, I think, started the work to do the training and have the Needham inspectors certified as well. And it's great that the food work has been done. The housing inspector training is, I think, is kicking off in March. I'm hesitating. I think in March, and at that point, we'll be able to have Sam and Jen Gangadaran, that's the other 50% of her time is as an inspector trainer, and Porig Martin, Pat, who I think y'all met last month. They'll all be able to be out and delivering trainings and working with all of the folks in all of our communities. And just one of our big accomplishments actually was in December getting to hire Pat Martin. He joined us on January 6th, and he's been busy onboarding, completing all the trainings that we need him to have for our department and to be an environmental health trainer. And he's a great addition to the staff. And I'm very relieved that we are, I think, for the moment, done with our hiring work. We've worked closely with HR. They've been helpful, and that has been nice. And then, right, I think all of our trainers have been getting trained on that housing inspector training. So I expect that we'll start being able to show results of numbers of folks trained and talking more about the curriculum in the coming months. And that is the end of my updates, unless there are questions.
Any questions for Gary? No, okay. One thing I'll note, and Tim, you can pass this to everybody. You hired an outside consultant for strategic planning. If the timing works out, you can try to get that for free. There are 2 groups in town that would do this. One is Community Action Partners. They're based at the Harvard Business School Alumni Association.
Okay.
The second is Community Consulting Teams. That's, I think, MIT Sloan kind of heads it up. It involves a number of other, university alumni. They provide free consulting services to nonprofits. Usually they want to make sure that it's kind of right sized, and we are kind of the right size for such a project, having worked with some of these before. So you can take a look at the application processes, but if you have something coming up,
great idea.
Yeah,
Save money.
Yeah.
Yes, that's great.
Can I say something, Tim, about shared services with my Medfield hat? And I talk and ask and then keep talking, so thanks. I just want to thank you and Carrie from the perspective, I've been on my board of health in Medfield for many, many years. And I just want to say that we are totally grateful because we have been without our 1 FTE since Labor Day, which was a full-time nurse. So Ginny incredibly supported us through Maven And now Jen, the regional nurse, is doing that, and she will be there to train and support and lift up the new nurse that's hired. I'm almost done. And what this grant is intended to do, because Lydia and I run a regional grant to see opportunities and have communities collaborate and enhance their capacity, is that Dover recently hired their nurse, first time, and Jen is going to be working with them, and Medfield lost their nurse. Our town administrator posted a full-time job and then did some consideration and talking, I feel, with Carrie and Shared Services and others, and she recently announced to us a restructuring of the existing budget, a small addition, and now she is presenting a full-time health administrator for Medfield, which would be the first time, continuing their half-time office manager, a half-time health inspector, and then a 19-hour public health nurse. So the reason why I believe that happened is because the select board in Medfield and the town administrator has benefited from learning and being a part of shared services. So it's absolutely a new department because the only FTE we had was a nurse for the past 2.5 years, and then a contracted environmental health agent and a half-time office administrator. So the grant is doing what it's supposed to do. And I'm also grateful because our board expresses this. Carrie and Sam came in and were able to do inspections, and it's to supplement the capacity we have, and it's really appreciated and valued. So thanks for letting me say that.
Good. Any new business?
Well, I don't know. Tim, are you aware of this? I came in, this letter was here. The Upland Terrace.
I'm not aware, I'm sorry.
This was, IES Environmental, Clean Soils Company. And it says, dear city officials, on behalf of Christine and David Slickland, and in accordance with public involvement requirements, the Massachusetts contingency plan, blah, blah, blah. They're notifying us of a oil tank leak on Upland Terrace.
So we get notified about those pretty often. I think it was addressed directly to you, so we didn't open it.
Okay.
Usually they're addressed to the department.
Okay, I'll pass this up to you then.
We do put them in the street file.
Yep. Okay. Any other new business?
The board may have seen the federal funding pause. The only thing that's been affected so far in our department is the food code standards work that Tara and I have been working on for years for which is funded by the National Environmental Health Association through the FDA. They have not made their January awards, and it's unclear if they will. That's in the order of $5,000 to $10,000. We've gotten it, I think, every year for like 7 years. So always nice to have, but that not getting that is not going to break us. The longer term question is, just some of the money that's flowing to states that then gets passed to locals stop? And that would be a bigger question. But right now, the only thing that we've lost or has been paused is $10,000.
All right. In case our next meeting is a month from today, 21st.
Yep.
Right here.
Yep, same bat time, same bat channel.
There you have it. Couldn't have said it better. With that, I'll take a motion to adjourn.
Motion, please. Close the meeting.
Yep.
Seconded.
Okay. I think we're all in agreement. All right, meeting adjourned. Thank you, everyone.
Thank you.
Thank you.